the concept of mesotherapy cocktail. Sorry, I don't know if you hear me. You hear me well?
Yes, yes, we hear you very good, Walid. We hear you.
In early 2000s, the concept of mesotherapy cocktail was reinforced, and the use of hyaluronic acid as essential active in aesthetic medicine producing began. A part of the evolution of ingredient, there was also an addition that has come to revolution the world of aesthetic is the derma roller. In 2006, Dr. Desmond Fernandez from Philadelphia, USA, evolved the induction therapy for resection collagen with the derma roller. As always, the Germany industry launched it and created the first derma roller. With derma roller, after that, as usual is done, thousands of manufacturers in Asia start to expand this discovery. I mean, like the dermapen, the first use of that. Which once again, after that, one of the companies from South Korea start to introduce the dermapen. This discovery also make an advances or a challenge for the cosmetic laboratory, which can be summed up in the production of high absorbent products. This advance represents a new challenge for a cosmetic laboratory, which is summarized in producing high absorbing product and saving the skin needs to more nutrient, not just vitamin, minerals, amino acid, and protein. The protein, by the way, were not enough because, for example, as the collagen molecular size was bigger than what the tissue is accept. That's why they have started to think about the composition of this protein and start to think about the peptide. The peptide is important for the creation of the protein inside our bodies. So from this point, the science give us the big opportunity to create it, and they call it biomimetic peptide. Bio means life, and mimetic means imitation. Just peptide, as is known from all of you, are chemical messenger that tell our cells what to do. Biomimetic peptide are synthetic peptides that are designed in the laboratory to mimic natural peptide. The big question: what do peptides do for the skin? All peptides are made up of amino acids, which the collagen, elastin, and keratin. These substances are what keep the skin firm. Peptide can also control the factor that contribute the skin tone. Sensitively, hormonal activity also. The big advances in the use of the biomimetic peptides at least come to the formulas to achieve great result in specific treatments such as wrinkle reduction, and that's why in Pressensa we have focused on the use of biomimetic peptides in specific treatments such as lip treatment, acne, depigmentation, e-contour, formulated to respond to the maximum level of demanding from our customers to have an effective and safe.
De la reposición de Alexandra.
About microneedling, the best technique, I leave you with the dermatologist, Dr. 𝐋𝐢𝐯𝐶𝐞, which is for us the best professional who can talk about it. And after that, she will carry out the demonstration. During the webinar, you can send us your question that we will try to answer during this period of time of the webinar. And those that remain unanswered, we will try to do a shortly form of question and answer, and we will try to send it to you in the next few days. And now, Dr. Katia,
yes,
and we will enjoy your participation.
Okay. Ион, покажите меня. Okay, thank you very much, Walid. I'm so happy to see my colleagues from all over the world. I think we have also some problems with connection, but we will register all this presentation. We will put it on YouTube, so you will be able to see this presentation and later, so no problem. I will talk just few minutes just about the microneedling, because I better we will do a practice. So yes, microneedling is a technology that uses microneedles in order to make a micro trauma in the skin, and as a result to stimulate natural collagen synthesis and to rejuvenate the skin. Also this technology helps also the penetration of active substances, so it's like alternative to injection mesotherapy. So it is very important for us to stimulate the production of collagen, because with age we have the less level of collagen in the skin, so the skin ages and wrinkles appear, skin became more saggy. So that's why we need to stimulate it through this microneedling. But this is very important, not to stimulate the formation of scars, of keloid scars. So that's why especially microneedling is ideal treatment, because it uses microneedles that can traumatize, but in the same time will not stimulate the formation of some scars. When we do microneedling, the penetration is of active substances is 95%. So that's why it is very important to use sterile products, and especially Pressensa products are perfect to use them with the Dermapen, because they will not cause any reactions, because they are absolutely sterile, and you can use them absolutely safe. Here you can see some physiological effect of needling, but I skip this. Here the results of histology before and after for treatment. So we really see that through this treatment we can stimulate collagen synthesis. It is also very important to use serums with vitamin A and C before and after the treatment. So that's why you can recommend the vitamin C serum from Pressensa. That has also 𝐿, rosehip extract, also the acne heal ampoule that has also and vitamin A, C, and also a complex of antioxidants, and a cream White Extreme that has anti-pigmentation and whitening, and also has vitamin A that stimulates the regeneration after microneedling. So like indication, we can use it all over the body. the needle length depending on the skin thickness, so we can choose depending on the area that we work. Here you can see contraindications. I will not tell about this, so you can see, you can read them. And the product. So from Pressensa, we have different products that we work with. With the product Active Eye that has also biomimetic peptides that stimulate the regeneration of skin around the eye, and that also prevents the appearance of dark circles and eye bags. Also Depigment that also has an hyaluronic acid, complex the vitamins, and also whitening peptide. We will work now. First, we will start from this product. To skip more theory, we promise that leave please all your emails in a message, and we will send to you the protocol of microneedling, how we can use microneedling technology in combination with Pressensa products. We will send you the protocols of 15 treatments, and also the new protocol with the Pressensa Luminosa TCA Strong, so that has TCA 25%, mandelic acid, and kojic acid. So we will send you also this protocol on email, and I think now it is better to start the presentation, and during the presentation you can ask me all the questions, and we will talk during. So let's see our first patient. We have a patient with hyperpigmentation, but not so visible, just a few pigmented lesions, but also we have some cupirosis, and we want and also dry skin. In this case we will use this Depigment because it has not only peptides and acids that work like anti-aging, like whitening, but it has also hyaluronic acid, antioxidants that have the effect also of anti-aging. So let's start the treatment. First of all, I use Deep Pure cleansing milk. I cleanse the face, the skin. This milk is very gentle, so it cleans perfect all makeup, very easy, but absolutely without any causing dryness to the skin. Has almond oil, also panthenol. So we clean the face and prepare the skin for micro needling. Okay, so first we clean it with the with this milk. This product is suitable for all skin types, even for very dry skin, absolutely, even sensitive. So you will never have any irritation after cleaning the face with this product. Okay. After we clean with the fresh hydratonic, this product also is perfect for all skin types, even for very sensitive skin. Has extract aloe vera and hydrates perfectly the skin, and absolutely do not have sticky sensation, and very good hydration effect it has. Okay, after we apply like light peeling, that the product that is called Exfoliate, this product contains fruit acids, 12%, glycolic acid, 12%, and also niacinamide, so or vitamin B3. So this peeling has like antiseptic action, also hydrates the skin, takes off the dry cells, dead cells from the skin. So we apply this peeling for 1 or 2 minutes. It's enough if we use it before microneedling, so 1-2 minutes. But the same product you can recommend before cleaning. So if you want to do a cleaning procedure for your to clean the blackheads, you can apply this product and leave it for 10 minutes or 15 minutes, and after you can make extraction of blackheads. But now I will wash this peeling in 2 minutes, because now I do the treatment of microneedling, so I don't need to leave it longer period. All the protocols of these treatments you can see at a website 𝐿𝐸𝐼𝐻.Doctor Academy. So we have like courses with microneedling, a course of peeling, beauty equipment, so you can see all these videos, how to work, what to apply, step by step, depending on the patient's skin and problem. And after you will also have protocols, and you can also ask questions, any question about any treatment. And you can see also a theory, all the theory about each technology. So now the skin of my patient is prepared for microneedling. So now I will use Siringa, Michaela, Siringa. Now I take a syringe, and I will use the product 𝐷𝐴𝐵𝐵𝐺𝐴𝐵𝐵𝐺𝐴. So the product has 2 ml. This product contains peptide for whitening, also arbutin, kojic acid, succinic acid, and also hyaluronic acid. So that's why this product will give us not only whitening effect to treat hyperpigmentation, but also it will give us the anti-aging effect. So I will use the needle with the 24 microneedles, and the depth, penetration depth, I will use, if we work with hyperpigmentation, usually at 0.3, 0.4. If you want anti-aging, till 0.5. But now for this type of skin, because we have also little couperose, I will use at 0.3 millimeter. Okay, so how we do that to start the treatment? We apply the treatment first, the product, the pigment on the we apply on forehead, and after I go with these round movements, 1, 2, 3, 1, 2, 3 at the same area of skin, slowly moving dermapen. Dermapen always must be 90 degree to the skin. Always move the dermapen to be very good contact, 90, especially 90-degree full contact with the skin, but without pressure, so no pressure. In case if we have, for example, areas of wrinkles, we can make like this step by step to press 1, 2, 3, one near another, like step by step. In this case, if we press, the patient feels little bigger sensation, little more painful, but it is not so painful, so this is okay. I choose in this case 0.3 millimeter because here we have more sensitive skin with the cuperos. In this case, we can do microneedling, so this is possible to do, but we do not. We can't do very deep treatment, not to penetrate, not to traumatize skin a lot. But if we have normal skin with no problem with cuperos, we can use till 0.5, 0.6 millimeters, depending on the skin. So, but you can see also the redness that appear. Cum acolo, se aude? Они слышат? Do you hear me? Everything is okay? Valid?
Yes, everything is okay.
Yes,
Okay,
everything is okay.
super,
We hear you very well. Sorry to have this incidents when we start with the Zoom, because there was some technical problems, but we will try to answer all questions that we had.
Yes, when you see the question, Valid,
Yes,
ask
I will
me
ask directly. Yes,
directly. Ask me directly to.
Yeah.
Yeah.
I will start with Amal Matmati. She asked, can we do peeling and microneedling in the same season?
Yes, the question is if we can do peeling and microneedling in the same session. So it depends what peeling we do and what kind of skin we have on the patient. For example, if we, in case of this patient with cuperos, we cannot do and peeling and microneedling in the same treatment, because it will be too aggressive. Even if we do our Renova or Rejova peel, that is absolutely non-aggressive, but we will not combine. We will make it in the distance 1 week between the treatments. But in case if we have very oily skin, thick skin with scars, for example, post-acne scars, but without inflammatory lesions, active inflammatory lesions. In this case, yes, we can first apply, for example, peeling with the protocol Renova Rejova, and after to work with the dermapen. This is possible, but not for all patients, and when we know that the patient's skin is prepared for this. So first to do one treatment without peeling, one peeling, one microneedling separately, and after we can do one together, but not only for thick skin, non-sensitive skin.
Okay. There is a question in Spanish. I will try to answer in Spanish. Just forgive me for 1 second.
Yes.
Sebastián Mota, por favor, si lo pueden traducir al español. Seguro, Sebastián, cuando acaba el vídeo lo estamos grabando y Inmediatamente vamos a intentar hacerle una traducción al español para que puedan perfectamente disfrutar y ver el contenido. Lo colgaremos en YouTube y le informaremos del link para que puedan verlo. Now I return to English language. Here we have a question from Delia. She said, how many needles, please? Maybe she asked
how many needles?
About,
now I use 24 needles. You can use also 12 needles if you want to work to more deep, if you want a little more traumatic treatment. But because my patient is with Cooperose and I do not want to traumatize her skin a lot, that's why for her I choose 24 needles. If you want less traumatize for the patient, less trauma, in this case you can use also 36 needles. That's why if you use 12 needles you will have more trauma than 36, and 36 less trauma.
Fantastic.
Okay, so now I apply this 1 more milliliter that I have on the patient's skin. Okay, and after I will apply a mask that in this case we can apply or vitamin C mask in case if you have more visible hyperpigmentation, so it is very good to use vitamin C mask that has whitening and also has the effect of anti-aging because it has an C collagen, elastin, amino acids, and vitamin C. But if we want to have double effect of and lifting and calming, in this case we can use Comfort Sense mask that has extracts from algae and also collagen and elastin, marine from sea collagen that calms down the skin and also gives for skin lifting and firmness. So I will apply here to have and anti-aging and calming this Comfort Sense mask. I apply it directly on the skin and we leave it for about 10-15 minutes, and after we wash the mask, and after we apply dermo repair serum. This serum is special serum to stimulate the regeneration of skin after microneedling. Now I will show you now the product. And after, at the end, we apply sun protection cream, but we will ask the patient to go, and we will call here another patient to come. We will do for another patient a treatment around the eyes with active eyes, and also for rose lips. Now we will do, but we will leave this patient for 15 minutes with this mask. Ok. Good. Voi aranjați și arătați pe mine. Acum eu o să arăt. So after, now the patient will stay with the mask around, with the mask about 10-15 minutes. You will see that this Comfort Sense mask is fantastic because it calms down the skin very quickly, and we do not have any irritation and redness after the treatment. Of course, if we did with the 0.5, 0.3, 0.4 millimeter, if we did the treatment with a longer needle or with the 12 microneedles, then of course we can still have some redness after the treatment. So after we will take off the mask in 15 minutes. We will apply on the patient's skin this dermal repair serum. This is a very good serum that that stimulates the regeneration after all traumatic procedures. So you can recommend it after microneedling, after peelings, after medium peelings, or after any other treatments maybe you do with microdermabrasion or after some extraction. So it stimulates the regeneration and renewal of the skin and repairs the skin barrier. And also you can recommend it for those who have some dermatitis. So it helps very quickly in 1-2 days. It repairs the skin barrier. So we apply it here after the treatment, and you can also recommend this serum to use at home for the patient. And at the end of the treatment, we will apply, of course, sun protection cream. You know, this is fantastic cream. I know that everybody knows it. It has and hyaluronic acid and panthenol, that and regeneration, hydration, and very good protection because it has SPF 80. So never patient goes out from your clinic, from your office, if you, without sun protection. So this is very, very important. And of course, you recommend this cream to use also at home after the microneedling treatment. No matter it is summer or winter, because sun we have all year round. Okay, so let's see now.
Dr. Katya, just I have 2 questions before
yes.
to answer here, because we have a question from Sarah. She asked if local anesthesia is right or not before this operation.
If we need to apply local anesthesia before microneedling or not. So it is possible to apply local anesthesia before microneedling if the patient is sensitive, or if we do in the sensitive area. For example, for first patient, we didn't apply it because we worked only with 0.3 millimeter and the patient is not so sensitive. So in this case, no need. But for example, for rose lips, I previously applied a cream with anesthesia, not to be painful. So this is, you know your patient, so you can apply the cream. To wait about 15-20 minutes before, then to clean it very good, and then you can do the treatment, so no problem. Another question? Or start
from Elizabeth Perez, just the last one from Elizabeth Perez. She asked, first she have 2 questions. First, if the video available to rewatch. Yes, Elizabeth, for sure. When we finish, we are recording now, and after that we will put it, so it will be available. And about the product, to show the product again, sure, you can see the video and you can see the product slowly after that.
Yeah, so we use now the pigment product, 2 ml ampoule vial. This product we used for first patient. Okay, good.
Okay.
So let's go. Let's start with the second patient. Let's see our beautiful lady. Okay. Here we will do the treatment for around the eyes and also rose lips. Here you see that I previously applied anesthetic cream, local anesthesia. And so because lips is very sensitive area, so that's why it is better to put anesthesia. Okay. So we start as always with the cleaning. So we clean the face and the skin with the deep pure milk. It's a very good product because it cleans any type of makeup, even makeup that it is resistant to water. So it is really easy to clean the skin before any kind of treatment. So we first clean the makeup. Okay. Here we will work with the area around the eyes. We will use the product _Active_Eyes because in order to, here we have like young patient, but you know that skin around the eyes is more the finest skin, and the first wrinkle usually appear especially around the eyes. So that's why you can use this treatment even at the patient of 26, 28 years, just to prevent. And of course, rose lips you can use at any age, but of course no from 18. Yes. Okay. I will clean one more time. So you see, we had here a lot of, quite a lot of makeup, but very quickly it is possible to clean the skin with the deep pure milk. And after we apply fresh hydratonic, that is also, I love this product a lot because it also cleans the skin and absolutely do not provoke any sensation. For very sensitive skin, you can use it also. Okay, good. Perfect. So we have skin prepared. Before the treatment, I will also apply exfoliate. This is this light peeling that has fruit acid extracts and glycolic acid 12% and niacinamide. So this peeling also gives like antiseptic effect for the skin. And it is very good to apply it even for 30 seconds, 1 minute, just to clean it better before microneedling. Okay, so here we have more sensitive skin, so we will not leave it for a lot of time, but if you have not so sensitive skin, you can leave it for till 2 minutes. But as I told that this product is also possible to be used before comedone extraction treatment. So in this case, you apply exfoliate on the skin for 10-12 minutes, and after you clean it, and it is very easy to clean all the pores, all the comedones. You can use ultrasonic to clean the skin and to extract the comedones. You can see these videos in beauty equipment course on Lika Doctor. So how we can combine different facial machines with the Pressensa products, how we can do, for example, cleaning, how we can do microcurrent lifting with laser, radio frequency, with plasma. So all these videos you can see at this course, and you will see that till the end of November we have 50–60% discount on these courses. You just enter lika.doctor and you can see all these courses. Okay, perfect. So now the skin is prepared. Okay, so we will start with the let's start with the rose lips. So rose lips is a unique product from Pressensa. No other company has this product. Thank you, Valid, for this. It has hyaluronic acid, also red currant extract, and glycerin, vegetable glycerin, that has the effect of hydration, regeneration, and it fills the skin of lips. Of course, we will not have the effect of volumizing, real volumizing that we can obtain from filler. But we can improve the quality of the skin on the lips. We can hydrate them very, very good, and also give this natural rose color because we have this extract of red currant. Okay, I will use the needle of 36 with 36 micro needles, and I will use 0.5 millimeters. If you have a needle with 12 micro needles, in this case use less long, so less use 0.3 millimeters. But if I use 36, it is possible to use also 0.5. Okay, so how we do this? We apply the few drops on the lips first, and then we do like a pressure, 1, 2, 3, few seconds, 1, 2, 3, 1, 2, 3, not so big pressure. It's not so sensitive because we applied a cream, anesthesia, with anesthesia. If we do not apply a cream, in this case, the patient can feel more pain. And so, and we do like 3 times, 1, 2, 3, and one more. 1, 2, 3. You can see some very small bleeding. This is normal. And now the product will penetrate very good in the skin. So I apply another drop of the product like this. Perfect. So the lower lip, with the lower lip, we finished. Now I apply a few drops on the upper lip. Okay, then I fix the skin like this to invert it. It's visible. And we do 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Okay, we continue. 1, 2, 3. 1, 2, 3. Of course, before doing this treatment, we have to ask the patient if they have predisposition to herpes. If yes, in this case, recommend to the patient to take antiviral drugs for 3 days after treatment. If they have herpes often, this means 3-4 times per year. If they had a herpes only once in their lives, in this case, this is not a problem. So this is the third step, the third pass. Okay, super. After this treatment, because we do this microneedling, we will have some edema also. This is also normal. Okay, that's it. And it will help not only to hydrate and to give this rose beautiful color, but also to prevent the appearance of wrinkles. So after, what we just leave for during the treatment, the product on the lips, and every 15 minutes now during the treatment, I will reapply the few drops. So the one vial has 2 ml, so we will not use, it is impossible to use all the vial in one treatment. So that's why you will reapply it once or twice now, and after you give to the patient this vial, because it has very easy closes, and it is easy to apply this product every day. So the patient continues to use this ampoule every day, 2-3 times 2-3 times per day, and during 1 week. So this vial will be enough for 1 week. Okay, so now let's go to and we will do the treatment around the eyes. I will change my gloves and
some quick question is allowed now.
Sorry?
Some quick question is allowed now.
Sorry, I do not hear what you ask.
You hear me now?
I hear you, yes.
Yeah. If I have some question, can we answer now?
Yes, yes,
yeah?
Of course, you can ask me now.
I have a question from Dr. Awatif. She asked, you adjust the pen on 0.5?
Yes, I adjusted the Dermapen on 0.5 and I used 36 microneedles.
Okay. And from Dr. Imtiaz, she asked how for long the edema continue and how to deal with it.
What?
For how long?
The edema, yes, I understood. The edema can persist for maximum 1 hour, usually after the treatment for lips. And if the patient continues to apply this serum, so every first hour it can be applied even each 15 minutes, so the edema will disappear very quickly. I also love this product after I do filler. So when I use Pressensa filler for lips or Seductiva medium or Seductiva volume, I give this rose lips ampoule just for the patient, just to apply topically without Dermapen. But if they apply this solution every 2 hours, and hematoma and edema will disappear much quickly because it has this red currant extract that has a lot of vitamin C and also antioxidants and improves microcirculation, vitamin K. So that's why it treats very quickly any irritation because we can use and recommend this rose lips solution also for very dry and cracked lips, only topical, without, of course, dermapen if we have some cheilitis. So in this case, you can recommend to apply every 2-3 hours, and in 2 days, so the patient will be absolutely happy.
From Stella, I think Stella, Dr. Lika have answered without reading the same question, because she asked if someone has a filler treatment, one can do this rose treatment. I think it's answered.
Yes.
And from Dr. Amal, she asked if we can inject rose lip instead of using dermapen. I think if you allow to me just to have a
yes, please, Walid, you will ask this question.
Yes, because to be frankly, there is medical opinion about glycerin, because the rose lip have a glycerin. One opinion said yes, you can, because glycerin is a vegetal synthesis of the, and another opinion said no, it's not recommended to be injected. But to be frankly, after our experience in this time of rose lip, in the life of the rose lip 2 years ago, we found that there is an excellent result with injection. And we found some, let's call it, some problem with it. It's up to the body. So that's why we recommend the use of rose lip with dermapen or dermaroller or another aesthetic devices. But I know some of you now, like Dr. Sharif, for example, from Yemen, who done it, and he said it is excellent result. I find from other countries also. So it is up to I think it's up to the doctor or the professional criteria. This is my opinion. I don't know what Dr. Lika will tell us about it.
Yes, in my opinion, after also I talked with Mr. Walid, and he said me that it is possible, and we have 2 opinions. Of course, as a doctor, I tried, and I had good result. But now it's like off-label use of the product, like Botox. We have on-label only for glabella region, but all another region where we use Botox, it's like off-label. The same is here. On-label is recommended to use with microneedling, but like off-label, and the doctor decides, yes, it is possible because this product is sterile and do not contains ingredients that can cause some problems. So this is my...
Thank you.
Yes.
Thank you.
Okay, so now we will work with the 𝐋𝐢𝐯𝐶 product. So I applied first around the eyes, and always I work not only when I work with 𝐋𝐢𝐯𝐶, not only just around the eyes, but also on forehead and temporal area. Why? Because first of all, 𝐋𝐢𝐯𝐶 has hyaluronic acid that hydrates the skin and fills some wrinkles that we can have on forehead and around the eyes. Second, that the Active Eyes has peptide 𝐒𝐼𝐸 that has Botox-like effect, so it will work in the area where we have mimic wrinkles. So not only around the eyes, it will help to treat mimic wrinkles, but also forehead mimic wrinkles you can treat with this product, and it will help a lot. Of course, we can't compare absolutely with Botox injection, but if you do it like more treatment, like a course, you will have also great result. And the product also has peptide 𝐈𝐸𝐸 that has the effect that treats puffiness, edema around the eyes, and also dark circles. So this is a real unique product that treats all the problems that we can have around the eyes, wrinkles, dark circles, and also puffy eye bags. So another product we really do not have, and this product we can use and with Dermapen, and also we can inject. Just if we start to work with forehead, we will use longer needle. So in this case now I will use 0.6 millimeter needle, but when I will work around the eyes, I will use only 0.25, because we know that the skin around the eyes is very thin, is usually less than 1 millimeter. So that's why we never use the needle as long as we use on the face. So if for forehead, you can use 0.5, 0.6 millimeter needle. For the skin around the eyes, no more than 0.25. But of course, work always and for temporal area, because it is important that this area to be firm skin, because if the skin is less firm in the temporal region, we have the drop of the eyebrow. So in case if we treat and we have lifting of the skin of temporal area, we have also this lifting of the corner of the eye and also eyebrow. So that's why always when you treat around zone around the eyes, treat also always and temporal area. So here you can work the same with the 0.506 millimeters, because here the skin is normal thickness. And when you approach around the eyes, then you need to turn the Dermapen to 0.25. So I will reapply a drop of product, and for upper and for lower eyelid. So we can work and on the lower and for the upper eyelid, you can take off the mask. So if we start with the upper lip, so I have now 0.25 millimeter. So I lift the eyebrow and I work only on the bone, not lower than the bone, and without any pressure, just like this, step by step, and do free passes. It's a little more sensitive, but you can really work with the upper lip, upper eyelid, in order to stimulate collagen synthesis and to stimulate the penetration of active eye product in the eyelid area. And after, I will start to work for the lower eyelid, like this. We can work also on the bone. We will not be very close to eye, but where you feel the bone, you can work very easy. And also, if you have these mimic wrinkles, you can work on them. So 2-3 passes, this is absolutely enough. And now we'll do this side. So we apply a drop. So lift the brow maximum. I love this product to inject. So I really do a lot of treatments with injectable mesotherapy with 𝐋𝐢𝐯𝐽 product. And I love the result because I really have a whitening effect around the eyes and anti-puffiness and anti-wrinkle. And what is important for me, like a doctor, the product is not painful. So when you inject the product, the patient do not feel pain. So it is very easy. You, of course, we apply some anesthesia before the mesotherapy, classic mesotherapy, but it is very easy to the patient because they do not feel real pain when we inject the product. Also in our academy, 𝐿𝐼𝐶.Doctor, we have a course of injectable mesotherapy, and all the protocols are based on Pressensa products, because we can really use all Pressensa products with the Dermapen, with the injection. So we have the protocols with for hair loss, for anti-aging, anti-cuperose, whitening, acne treatment, for neck, hands, and also for body, for double chin, for cellulite, lipolysis for the body. So we have all these products in Pressensa, and you can take now also this mesotherapy course with all theory about, in general, what is mesotherapy, how to use, what kind of needle, length of the needle, penetration, everything, theory, and also 12 videos with the patient, so where I show all this treatment. And now you have the possibility to buy till the end of November with only €100. So this is a super price on Black Friday, so please you can take this opportunity. Okay, so
I have a quick question
Yes.
from Dr. Sharif. He asked, if we use active eyes injection, how much the depth?
If we use around the eyes, usually the depth is 1 millimeter, and we use 32 gauge needle or even 33, but it is good to work with 32, 4 millimeter needle. We inject 1 millimeter depth, and we do small papules like 2 millimeter, and the distance between the papules around 5 millimeters. Okay, and now I will also use for the rest of the face the product Skin Aging. Skin Aging that has vitamin C 20%, that is also perfect for young skin. and the skin with 𝐾𝐜𝐳 to prevent aging. So in case if we work, and now I will make also 0.5 millimeter needle, and I will apply the product all over the face and will work on it. Also, this with vitamin C, skin aging treats 𝐾𝐜𝐳 so good, and also for young patient, I use a lot this product to prevent aging, to prevent hyperpigmentation, to also if we need some whitening effect, also it is very good for young skin. Of course, for whitening we can use also depigment, or from Pressensa we also have the products, you know them, whiteness and brightness, that have glutathione, high concentration. Brightness has 600 milligrams, whiteness 1200 milligrams, so, and also vitamin C. So in this case, like anti-aging and antioxidant is a great product. You see here we have one inflammatory lesion. So when we work with Dermapen, never work on inflammation. So, but it is not a problem if we have one lesion, just not to work on it. But if we have a lot of acne, inflammatory acne, in this case, we will not use Dermapen. It is better to use first to do peelings. So we have the protocols of acne peel with the blue and red light. You can use and Renova Rizhova combination, and also Luminosa TCA with acne heal. Also all these protocols you will you can see in the videos in the Academy website. But as I promised, we will send you the protocols of 12 treatment with microneedling with the Pressensa products. So you will see step by step what products you need to apply, how many milliliters, what kind of serum is recommended, so everything. It will be very easy for you to work. So in this case, now I apply the rest of vitamin C on the skin. Okay, we can apply also on the neck area. Here we do not need, because we have young patients, so we do not work on the neck with the Dermapen here for this patient. But normally, if we have all the patient, of course, it is very good to work with the Dermapen also, and for example, for neck and the zone décolleté, you can use it also for to the skin around the eyes. So this is really very good treatment and do not have any contraindication. Okay, and now I will, you see, during the treatment, I reapply the rose lips, so every 15 minutes. Okay, and now I will apply a mask with the vitamin C. It has also amino acids, collagen, hyaluronic acid, C collagen, and elastin. So it has like anti-aging, antioxidant, whitening, and this mask, I call this mask like a sauce mask that helps to calm down any irritation. Sorry, we have ambulance here. We have the hospital, so they always drive here. So if you have any irritation, redness, dermatitis after microneedling, after peelings, you apply a vitamin C mask, you wait for 10-15 minutes, and you see that the skin is calmed, no red. Of course, if we did more deep treatment with a longer needle, we can still have redness, but what is important that the patient will tell you that they do not feel any pain after. So you know that when we do microneedling, directly after the treatment, the patient can feel some sensations, burning sensation or itching, something. But after we apply this mask, after 10 minutes, they feel absolutely good, fantastic, no problem, no irritation. So when I first applied this mask, I really can't believe that it was difficult to believe that it really this mask can do such great things. So I really recommend you to use it in your practice, and you will see how fantastic it is. And I apply it and after injection mesotherapy, so it is also possible to apply to calm down the skin, the irritation, after peelings, after the same luminosa strong. So we leave now the mask for 10 minutes, then we will rinse it off and apply some protection. So let's see the question now.
Some question I have from Dr. Imtiaz. She asked, after how many seasons the patient get benefit from around eye treatment?
Yes, how many treatments we need to have? Usually we recommend about from 3 till 5 treatments, depending on the patient's age and the problem that the patient has. If we have a young patient, even 2 treatments really is enough with the microneedling. And then, for example, for this patient, I will recommend to do not microneedling, but to continue with the microcurrent. This is like a machine that no needle mesotherapy, to continue with no needle mesotherapy, but to use it in combination with active eye, because with the help of the machine, the product will penetrate and will give great result for this young patient. If we have older patient, for example, with the more visible wrinkles, in this case, of course, we need 4 or 5 treatments that we do once in 2 weeks, not in 1 week. In 1 week, it will be too close. The collagen will not be able to synthesize. So that's why we recommend once in 2 weeks, 4 or 5 treatments. Of course, if we have dark circles or puffy eye bags, also it is good to combine with the microcurrent, with the this stimulation with electro stimulation of the skin, of the muscles, that takes off also the liquid around the eyes and makes edema less visible. But around 3 or 5 treatments, usually it's enough. And the patient really sees the result after 1 or 2 treatments. So they will come back to you because they will see really the result. And after we repeat it once in 6 months, or for example, you can 3 or 4 treatments once in 6 months, or you can recommend once in 3 months, like maintenance, only 1 treatment once in 3 months.
Okay, and the other question from Dr. Stella, she asks, how long time after Botox treatment can use this product? I think the question comes from rose lip, but yes, you can answer if you treat after Botox.
Mm-hmm. Yes, if we, for example, if we injected
which
Botox,
time you can do that?
Yes, if we injected Botox, for example, around the eyes or for forehead, we need to wait minimum 3 weeks. First of all, we wait 2 weeks to have the effect from Botox. And after also 1 or 2 weeks to wait. So usually 1 month better to start some microneedling treatment after Botox. Not and you can do it once in 2 weeks. So this is possible, but of course not at the next day. This is no.
And I have another question. From
yes,
Dr. Wafa. She asked how long time rose lip effect persisting?
How long rose lip effect? So it depends how many treatments we did. For example, if we did only 1 treatment, the effect will last for about 3-4 weeks, no more. But if we will do like 4 or 5 treatments, 1 in 10 or 14 days, then we will have more lasting result for about maybe 2 or 3 months. But of course, not so much, because this is not tattooage. We need to understand this. This is something absolutely natural, so we give the natural rose color, and we give also hydration, collagen stimulation, and reparation of the skin barrier. So but if, for example, the patient will use this rose ampoule at home to continue to have a long-lasting result, it will last more. So, for example, one ampoule, if the patient uses at home, is enough for 7-10 days. So 3 ampoules per month you can give to your patient, and then the effect of the treatment will last longer if they will apply it 2 times per day.
And from Dr. and this is the last question, and after that we leave you to finish.
No, Angela, you can ask me till tomorrow.
Yeah, from Dr. Angela from Sweden. Hello, Dr. Angela. Nice to have your question here. How many seasons are needed, and how long time between each season can we do for rose lip? And she have the other question is how long time after filler can Kilian do rose lip? This is the 2 questions.
Yes, so how many treatment of rose lips we need? So for rose lips, also from 3 till 5 treatments. This depends on the skin of lips on the patient, because if we have very white skin, less rose, we need to do more treatment till 5 to have this good rose effect. And also, if we want anti-aging, not only hydration and the color, in this case also we need till 5 treatments, once in 10 days. If we combine with the filler, so usually after 3-4 weeks to start to do with microneedling rose lips. But as I told that you can recommend rose lips to be applied topically for your patient after filler procedure, but with Dermapen, not before 3-4 weeks after filler.
The last question that I have from Dr. Bülent from Turkey: how is the patient selection criteria for the pigment and whiteness, between the pigment, whiteness, and brightness? 3 products from Pressensa.
Yes, this is a good question because also many doctors ask me that we have whiteness. Whiteness, this product has glutathione 1,200 milligrams, vitamin C, and collagen. So brightness has 600 milligrams and vitamin C. So these two products are very active, like depigment, like whitening. They have very great whitening effect. But they have, if you work with microneedling, and you want real whitening, you can use whiteness or brightness. But if you want combination, if you want to have not only whitening but also hydration, because depigment has and hyaluronic acid and also peptides, anti-aging peptides. So if you want this effect of lifting, hydration, and whitening, in this case you can use depigment. For example, I can tell you what I personally use for my patients. If I do injection treatment, I more often use depigment. So because I love that this product is not, when I inject depigment, the patient do not feel pain, and I have very good results of whitening and anti-aging. But if we use whiteness or brightness, if we inject, this is painful. It has great effect whitening, but painful. So in case of more visible pigmentation, in this case, you can better use whiteness or brightness. Whiteness when you have more visible, and also for all the patient after 40 plus, because it has also collagen. But you can't really inject it because the patient will tell you that it hurts. So whiteness and brightness use with Dermapen, and you will have great result. But if you want to inject, you can use brightness. But if we have colleagues who do not do injectable mesotherapy and they want to do, for example, Dermapen, it is possible to do Dermapen with depigment.
Okay. We will wait for another question, and after that I will come back.
Yes, till we wait for the question, I will take off the mask. I will wash the mask, and I will apply cream around the eyes. Pressensa has also great circle eye cream that is so good, fantastic cream. Everybody loves this cream. Who tries once never takes another. This is about me, because it really helps, and you see after even 2 weeks, if you apply only cream, you really can see that the wrinkles are less visible. The cream also has an hyaluronic acid and Botox-like peptide, and vitamin A, rose sheep extract, so it improves and microcirculation around the eyes. It helps to whitens dark circles, and also treats wrinkles. So you recommend this cream, Circle Eye Complex Cream, for the patient if you do, especially if you do the treatment around the eyes. So now let's clean the skin, and you will see how good the skin looks like. So no redness, no edema, and how good the mask with the vitamin C works. So you can see this in even 10-15 minutes. You can have this great result. and the patient always goes beautiful from your treatment. This is also important, without redness. Okay, so we clean the mask, and first I will apply derma repair serum to stimulate the regeneration after the dermapen treatment. Okay. So I take dermapen. It has hyaluronic acid, arnica montana, antioxidants, centella asiatica. So the components that panthenol, that component that's really stimulate the regeneration process and helps the skin to regenerate so quickly. So we apply it after the treatment, and we can recommend the patient to apply it also 2 times per day after their before or sun protection cream in the morning, or before the cream in the evening, depending what kind of cream the patient use. Now, so we massage it and penetrate derma repair. Now I will apply circle eye cream. Circle eye cream. So we just need 2 drops. And we apply also on the bone projection area. So we apply around the eyes. The patient will never have edema in the morning after this cream, so they can apply it in the evening and they will see great result. Okay, and after we apply, if we have during the day, we always apply sun protection cream, but now it's late, so it's dark. So in this case, we do not need to apply sun protection. And I will apply for our patient acne-less cream. This is fantastic cream for young skin, for normal to combination skin, which hydrates very good and has also anti-inflammatory effect, because we have here some inflammation, so we will prevent it. So it's great cream that I always recommend for the patients with the combination skin. So we apply this cream, and 1 more drop of rose lips I will apply, and I will give the ampoule with the rose lips to the patient to use it at home. Okay.
Some question
yes
is allowed
yes.
now? Yes. Dr. Karen from Malta, she asks, would you recommend that the peeling treatment is done 1 week before applying mesoven treatment?
Sorry.
And then for better result on pigmentation?
What kind of treatment?
Would you recommend that the peeling?
Yes.
Yes. What do you recommend? Yeah.
Yes. For example, if we want to treat hyperpigmentation, of course, it is better to use a combination of peeling and also microneedling, but not in the same treatment. So you can, we can first do, for example, microneedling treatment after 1 or 2 weeks, depending what length of the needle we use. So for example, if we used 0.3 millimeter needle, we can do peeling after 7 days. If we use longer needle 0506, then better 2 weeks to have this period of rehabilitation. And after to do peeling, peelings for pigmentation. So depending on the patient or where you live, if you have a lot of sun or less. So if you have a lot of sun, I recommend not to do very aggressive treatments, especially when you treat hyperpigmentation, not to provoke post-inflammatory pigmentation. In this case, you do combination of peelings, Renova, Rijova, and after this after apply depigment, or you can apply whiteness or brightness, and then mask with vitamin C. So after this kind of peeling, in the protocols, you will see white peel. It is called, but you will see this in protocols. We will send immediately after the webinar these protocols on your emails. So after this peeling, you will not have any exfoliation, because the pH of these two peelings is 3.5. So you can easily use them if you have a lot of sun in your country and the patient has pigmentation, and in combination with Dermapen. If, for example, not so much sun, and in this case you can use for example Luminosa TCA peel, this peeling in combination with the microneedling. The period of between the microneedling and peeling with TCA must be minimum 2 weeks. This peeling has TCA 12%, also kojic and mandelic acid. This peeling depends how many layers you will apply. So you can have very small exfoliation, light, or if you apply 2 layers, you can have a little more visible. And if you apply 3 layers, it will be more visible exfoliation, but in the same time, not so hard. So will not produce any crusts, and real rehabilitation and possibility to have post-inflammatory hyperpigmentation. In the protocols, you will see TCA whitening peel, the protocol, how you can use it. So after the peeling, you apply or brightness or whiteness or depigment. But in case if you have more older skin, or more thick skin and large pores, and also hyperpigmentation, but when the patient will have very good protection, will protect their skin from the sun, you can do U1 peeling, Luminosa TCA Strong. So this peeling contains 25% of T3-chloroacidic sorry. In this case, you have to be to apply only 1 layer, to wait about 5-7 minutes to see how the skin reacts, and only after if you need to apply the second layer only on the areas where you have hyperpigmentation. But you never start with this peeling for the patient. First, you need to prepare the skin with the more light peeling. So you can do 1 Renova Rijova peel, then you can do Y Luminosa Classic TCA peel, and after you can do TCA Strong when the patient's skin is ready. Okay, so we can see how our patient looks like. Perfect, beautiful. And I will give you this vial. So you will apply this product 2 times per day. Okay?
Okay, thank you.
Thank you. Okay, Vali, do you have any questions? Do you have any questions, our doctors?
Yes, I have one question from, he asks about in case of, let me see the question in good way, because it disappeared. Just a minute. Yeah, whitening product. Is it?
Tell me one more time, please.
Yeah, whitening product. Is it benefit for case of orogenizes and deep melasma, which come with deep hyperpigmentation?
Yes, we can use these whitening products also for melasma and like a chronic disease, but we need to understand that this is a long treatment period. So we will not have in melasma, will not have the result we can't say in 3 treatments you will not have pigmentation. No, this is impossible, unfortunately. So it is a long period of treatment. Maybe it will take half of the year, maybe it will take 1 year, but if we will what is important to do, not only the professional treatments to treat hyperpigmentation like mesotherapy, microneedling, or peelings. This is also very important. I can tell the most important thing, this is sun protection. So if the patient, and the second thing is the prevention of melanin synthesis in the evening. So these are 2 creams that are absolutely necessary for the patients if we treat melasma. So in the morning they apply sun protection cream. It is possible to combine with vitamin serum. So, but it also is important to reapply sun protection cream every 4-6 hours. So sometimes patients do not do this, and they come to us and ask why I do not have the results. So it is very important to teach the patient to have a home care, like correct home care. So to reapply sun protection cream every 4-6 hours during the day, and in the evening to apply a cream that really stops the production of melanin. And in this case, if the patient will use it every day, it will be 1 year minimum. In this case, combining with the whitening treatment, so we can do once in 2 weeks, about 4 or 5 treatments, and then the patient comes to us once in a month only, but uses these products at home, and in this case we will have good results.
From now, I think I don't have any other question. If someone want to ask any question, you can send us now.
Send us, yes.
Any question that you have. And now I have a question from Dr. Hanan. She asked, how long stay the color on rose lip?
The color from rose lips usually stays from 3 till 6 weeks usually. If you do 2 free treatments. If you do more treatments, it will stay till 8 weeks, but after you need to repeat, otherwise it will not stay, or the patient needs to reapply it at home topically.
I would like to add something here about, because
yes.
I have questions about
Please.
rose lip color. The concept of the rose lip is not micropigmentation. We are not doing micropigmentation with rose lip. The new concept that we add to this treatment is really to give the natural tone of the lips, and that's what the new that we bring to this aesthetic treatment world. Because if we want to do micropigmentation and give the color like rose color or red color for the lips, we should do another kind of product, and that's not our not our main business. What we would like to tell everyone who ask about the color, the thing that we want, as Dr. Lika said and done the demonstration, that to bring again the natural color. That's what we would like to get. So yes, it return or become more rose than the usual. It come more life. It give it bright. It give it vital activity on the lips. It give it something like more sensual, but not at all to give it like red color as it. This is the most important thing about the concept of rose lip.
Yes, I agree with you.
I think more questions. I don't have just a lot of people. So I will leave you the last word if you want to add something.
Yes. First of all, I want to thank all of you, dear colleagues, that you stayed with us all these 2 hours. So yes, we are so happy with this webinar, and I think with Mr. Walid, we will think how we can continue this like a tradition to make it once in few months. And please, when we will send you the emails with the protocols, send us what you liked, what you don't like, what you want to the theme that you want to us to open in there, to show me, for example, or peelings or some with beauty machines, how we can combine Pressensa, how we can work with fillers. So anything that you want to ask and for me to show, please ask and enter to Lika Doctor Academy, register, and you can take these courses now with a very good price. Thank you, Mr. Walid, a lot, because I'm so happy for more than 6 years of our cooperation, working together. With these great products, yes.
Like this.
Yes.
Thank you. We are happy to have you. You are our great dermatologists that we had. With you together, we developed protocols that give benefit for a lot of customers around the world. Now we are present in more than 40 countries, and all people once try Pressensa, once they stay with us, and it's frankly. And for sure, thank you for everyone. Thank you for everyone from, I think we have been from a lot of countries, from South America to Vietnam, from Europe, north of Europe, east of Europe, west of Europe, from Africa, from Middle East, from all countries. I am happy really to have all of these people at the same time together. We all have the same intention to give our best to our patient, to our customers. And I hope in the next few weeks we will do another webinar on peeling, because we have the TCR strong, this strong TCR will give us will give you a lot of opportunity to have the best treatment. So thank you, Dr. Lika. Thank you for everyone, and I hope you can for sure we will record and we will put it again, this webinar, so you can see it again. And we will be in touch. A huge hug for everyone.
Thank you. Bye-bye.
And thank you for everyone. Thank you very much. Bye-bye.
Bye-bye.